હજી દુખે છે અહીંયા? 1 to 10.
1, 2, 3, 4, 5, 6.
લિપ્સ આગળ લે, પાઉટ હજી આ મૂવમેન્ટ નથી. યુ હેવ ટુ પ્રેક્ટિસ. ઠીક છે, આ ગયા પોઝિટિવ. So we have a 23-year-old patient today. So she had a complaint of cleft maxillary hypoplasia with her upper jaw being backwardly placed as compared to the lower jaw, and that is mainly because of the hypoplastic growth of the maxilla post cleft surgeries. So as you can see, initially she had a negative overjet of approximately 4 to 5 mm with a positive lip step, giving a typical cleft maxillary hypoplasia look. But now we have not completed the AMD in its entirety. We had planned for an anterior maxillary distraction surgery, and we started the activation of the distractor device 7 days ago, that is a week ago. And now after post activation day 7, you can see there is a nice fullness of the face for the patient. You can see there is a good fullness of the mid face. The positive lip step is almost gone. Hold below. So you can see the upper lip has come forward nicely, and the lower lip is a little bit behind the upper lip. Still, she'll require approximately 3 to 4 mm of activation to ensure some amount of overcorrection, so that once there is some amount of relapse, which is expected to be around 10 to 20%, she will have a good facial profile. Also, if you can see, we have been able to manage to jump the bite. The maxillary segment is going into slight open bite, which is expected with anterior maxillary distraction. But if you see, the jet is more or less achieved, that is a positive jet is achieved. Another 2 to 3 mm of overcorrection and we will stop the distraction.